Hi everyone, my name is Hafeezah. I'm the founder and CEO of Backpack Healthcare. Backpack started from a very personal place. In October of 2020, my son who was 6 came to me and told me, "Mommy, I feel like I want to kill myself." My heart broke, I didn't see it coming, and I did not know what to do next. Because of my son's disability, he was on Medicaid. As I tried to find solutions for him, I kept getting turned back, forward. I even reported to the CEO of a national mental health company and still could not find care for my son. There are more than 40 million children in the US on Medicaid that need access to mental health services. 1 in 5 children, as we all know, also are struggling with mental health. But only 30% of providers accept Medicaid. Just think about that for a second, those who need care. And that's when I started Backpack Healthcare, to be one of the first national companies that focus on children with Medicaid. And when I think about that journey, is that I looked at traditional mental health care. We first started with in-person care, where we know nothing what happens in between sessions, over 144 hours between your session before you find out if you get what happens in the session. And then COVID hit, but we have that same no in-between session support. Your therapists don't know what's happening, but then we do it via telehealth, but now there's more eligibility for access. There's more opportunity for more people to be reached. And we wanted to make sure that we do it differently. How can we provide traditional support for our patients in between care? And we build a self-care app so that in between support from our therapists, they're able to find out what's happening. They can track their outcomes. They can be able to see like if they're chatting with the care companion. And we also included bibliotherapy to ensure that we have clinical interactive stories. And our chat care companion is in over 250 languages, making it a global and affordable way to expand access to care globally and internationally. But we didn't stop there. We started thinking about our therapists. If they have to do this compelling work every single day, the burden of having to do 23 plus hours a week of administrative burden, having to listen to these incredible stories, horrific stories, have to go home to their families, to go home to their parents. Why does it take so much work for them to do their treatment plans, their progress notes? It just created more of a toxic system. So what we did is that we worked with a therapist. We launched a residency program to ensure all new graduates coming into our program have the tools necessary in a place to practice. Then we built AI solutions, so automated treatment plan generators, automatic progress notes generators, so that they are able to take that time down. Now, guess what? It only takes them 2 hours a week of administrative work through automation. So combining the solution of supporting the children and focusing heavily on the people who deliver care, remember that 1 in 5? That would have been 8 million children that would have needed access to mental health services that were on Medicaid. Not thinking the general population just on Medicaid. But guess what? If every single provider within the US have that self-care solution, in addition to the care companion, to the AI solutions, we would have been able to help every single child in the US with the same exact amount of therapists that we have today. I want you to think about that, of combining solutions that are built by therapists for therapists to be able to help support them within their journey so that they're able to get better. I have to admit and tell you this right now is that there's been a lot weighing on me thinking about how does the Medicaid cuts affect our population. There are solutions that people are looking for to make impact, to be able to help support our kids. And these are affordable ways that we can do it to make impact. I am happy to say that my son is doing well. He's our chief child innovator. He gives us a lot of great, incredible feedback and how we can make better to design solutions that's built for kids, for families, but also for our therapists and our families so that we can make an impact and difference. And because of him and the incredible team that we have been able to build incredible solutions to transform pediatric mental health. And I challenge each and every one of you today is that whenever there's a problem that needs to be solved, never be afraid of solving it, because you never know that one day that your solution can transform. We've helped over 4,000 families, more than 50,000 sessions to date, showing that we can make impact, and I know each of you can too. Thank you.